As our clients are going through healthcare transactions, we always find that real estate falls at the end of their decision-making process, and they're not even thinking about real estate. So while we're a little bit biased on that topic, we think it's so important to get your lease in place and correct and optimized in advance of a healthcare transaction, not the day before or the month before, but a year or 2 years before.
A couple things. One, I would focus on management team, focus on employees. Typically that is the number one question we're getting asked when we go into a transaction is, who's that management team? Who's going to be leading the charge? And how are you empowering them? What are you doing to give them the ability to make decisions and grow and change as an organization? Most all buyers are very interested in that management team and the larger employees to begin with, because as you guys know, good employees are hard to find, and they want to retain those employees. The other thing I would say is pay attention to your financials, clean them up, get a Q of E. It's never too early to start. If you can sit down and go through and actually have a quality of earnings report or evaluation from a knowledgeable source, that gives you the ability now to start cleaning up and poke holes where your financials are weak. I cannot tell you how many clients I've had in the past that have said, oh no, my financials are spotless, they're great, and all of a sudden they get a QV that happens and they get really ripped a new one, unfortunately. Get a QB, get a financial audit, and do it now, 12 months ahead of time, because that gives you 12 months to prepare.
So what I think is the best advice for anyone considering a transaction in 6 months, 12 months, 18 months, is to plan in advance for it. And there's a bunch of legal issues that a lot of clients, for legal compliance reasons, are not doing. And catching those 6 months, 12 months, 18 months in advance, and with very little expense, fixing those issues going forward will help them get a maximum valuation. And I'll just give you 2 or 3 examples. Number one, if you own your real estate, make sure you have an arm's length lease in place that's both compliant and commercially reasonable and standard in the industry. This will maximize the value of your real estate should, after the transaction for your healthcare business or practice, after that closes, to potentially sell the real estate at a point in time when you have a new owner and a long-term lease. That's number one. Number two is make sure that if you're not on a monthly basis doing federal exclusion checks on every single employee of your company, and I mean even the receptionist and the janitor, and board members, not just healthcare providers, then you should immediately start doing that. There's national services that do it very inexpensively. You just run your payroll list and 1099 list through them. It's required by law if you're treating any federal program beneficiaries. And I've had multiple deals where that wasn't being done, needed to be corrected, and resulted in the buyer requiring a self-disclosure. Even though it wasn't a huge settlement, it delayed the deal substantially and resulted in a slight reduction in the value. Number three is the Stark Law. Make sure you're complying with the Stark Law. Don't wait till due diligence starts on a potential partner that you have an LOI with. This is not only how you whack up designated health service profits from things like imaging and physical therapy and laboratory and drugs, but also if you provide advanced imaging. A lot of clients with CTs and MRIs are not providing the notice that's required when one of their doctors provides an order for advanced imaging and doesn't provide them a list of 5 other facilities in the region where they can get that advanced imaging done. And that's, again, mainly for MRI and CAT scan. Those are the top 3 in my view. But a fourth one, just real quick, is credit balances. If you run your, AR report, there might be 25 pages. The last few pages will have negative numbers. which are credit balances that you owe money back to a payer or to multiple patients, like $10, $15, $20, $30, $50. Most state laws require that money be paid back, otherwise you're violating state law. So definitely, if you have a lot of those, start refunding them very soon, because that is another big regulatory issue that comes up and delays deals and causes financial renegotiations.
So I would say prepare. And my key phrase for you is try to find out everything that you know or is knowable about your company so that you can manage the risks that you're invariably going to encounter during a transaction. For example, perhaps some of your contracts are not up to speed, or maybe you haven't had a regulatory audit in the last 12 to 18 months. Those kinds of things, so that when the buyer comes in, if you're on the sell side and you're engaging in due diligence, you'll be able to answer those questions effectively. You'll have a ready answer. They'll be prepared, but they'll be prepared accurately. And it's okay if you don't know the answer to that question. But if you're prepared for that question and you're able to deal with it, that will inspire buyers to have a lot of confidence in who you are, who your company is, and where you expect to go in that transaction.
Yeah, so as you're thinking about getting ready to explore a transaction, I think the most important thing you could do is get prepared and get organized. So, hey, are we compliant? Did we actually go back and double check whether we're meeting fair market value elements around real estate or related services, right? Do we have the right structure in place? And then are we thinking about tax and estate planning? Because you got to do those things well in advance. The more that you get organized and prepared in the beginning, the less you're going to have issues and surprises later on. And then lastly, and probably most importantly, is set expectations right. Set expectations across the organization within the ownership team so everybody understands what you're really looking for and the end goal, because it's going to take compromise, pluses and minuses to get there in the end.